hospice morphine versus ER morphine. Hospice morphine versus ER morphine. Good morning. Michelle Ledbetter here, hospice and palliative care registered nurse. So this morning I wanted to pop on here before these grandbabies wake up and talk to you about morphine. This seems to be such a topic where it a lot of times will prevent people from either going into hospice, or once they get in hospice, families are very reluctant to administer it. So I wanted to share some information with you today to hopefully clear up some of the misconceptions about morphine and help you utilize this information so we can make some better choices at end of life. So again, it's one of the biggest concerns when hospice is in the home and we recommend morphine. The first thing that people usually will do is kind of panic, and they have heard about morphine on the streets, and that's a whole different gig, guys. That's a whole different thing. That's a whole different game. They often wonder if what we're giving is too much. So what I'd like to do this morning is put it in perspective, put dosing of morphine into perspective for you so that it might give you a better sense of what we're actually doing here for your loved one. So a common dose of concentrated morphine in hospice is 5 milligrams. We typically start with that. And the way we administer it is we administer it in a syringe, 0.25. Unfortunately, I don't have a syringe with me, but it's a very small amount in that syringe. And we administer it either under the tongue or right inside the mouth between the cheek and the teeth. It is absorbed into the buccal membrane, and that is how the person receives relief. We give that dose of morphine for either pain, shortness of breath, or also what we call air hunger that can commonly happen at end of life. Now, what I'd like to do is compare that to what would be administered in the emergency room for, say, somebody coming in for chest pain. If they come into the emergency with chest pain, they will receive morphine too. Staff is not trying to hasten their death either, and they will get about 2 milligrams to start. But the difference here is they are administering it IV, straight into the vein. So that is a much stronger dose of morphine than what we give in the home, the liquid morphine that we give under the tongue. Now, morphine is significantly stronger in IV form versus oral. Think, it's got to go through your whole digestive tract before it actually starts working. Many hospice patients receive less morphine than patients routinely receive in the emergency room for chest pain, broken bones, lacerations. So nurses that are administering morphine in hospice, we're not trying to hasten your loved one's death, and a lot of people have that misperception that morphine is what actually causes the death. We're actually trying to relieve suffering. The goal is comfort. The goal is easing pain. The goal is helping someone breathe easier. The goal is allowing a person to rest. Now, what will typically happen, there's one of two ways this can go. Once a person gets morphine, if they've been working really hard to breathe, they don't have to work so hard. So sometimes they'll come into a place where they have a little more energy. They can be a little bit more engaging. That happens when giving small doses of morphine. People kind of wake up and they can engage more because they're not working so hard to breathe, or they're not working so hard to not think about the pain that they're in, right? The other thing that happens is they have been working hard. The body's slowing down. Systems are changing. They finally can rest. They're no longer working so hard to get that air, and they can rest. Once they rest and they're peaceful, typically they will go on and pass. They were passing anyways. The disease progression is what is causing them to pass, not the very small amount of morphine that we administer. I hope that you find this information helpful. My goal here is to help reduce fear around death and dying. If you did find this information helpful, please subscribe, like, and share. I would not be able to provide this content to you without your support. So thank you so much. I think I just heard a baby stir. So I'm back into the house being yah-yah. You guys have a great day. Until we see each other again, be good to each other. Bye for now.